I teach, I learn, I treat, I invent, and I care.
You have to be able to communicate.
Motivate.
Every experience is different.
There's no cookie-cutter approach.
And it's rewarding.
I strengthen.
Enable.
I treat.
We heal.
You're helping those who can't do.
Caring.
Educating.
Encouraging.
Just helping people.
Funulating.
You need to go in with a completely open mind because something very cool might come out.
I'm a physical therapist here at the National Rehab Hospital in Washington, D.C. This is the cardiac rehab, so we're working with patients with heart conditions. You get to use your thinking skills, analytical skills, problem solving. I mean, her BP 135/95. And you get to do so much. It's really awesome.
Right now we're in Independence Square. It gives the patients an opportunity to practice the things that they've been working on in a real-world setting. So this is a kitchen that we're in right now, and it's set up just like any other kitchen. The sink works, it's got knives, it's got plates, it's got food, and you get to practice. The best thing about being a physical therapist is getting to see your patients improve. When you get to see them go home on that last day and they're walking out when they came in a wheelchair or they came on a stretcher, and you get to see them leave. Walking.
You want to walk down, touch the wall, come back to the exact same spot. I'm a board-certified neurospecialist in physical therapy. I see everything from spinal cord to people who are dizzy, stroke. I mean, you know, people who come back from Iraq. I mean, you name it, we see it. We're looking to see what we can do to maximize his overall function. It's never boring. It's always different, and you can actually try to pull in your clinical reasoning skills, the best evidence that's out there, what the patient values, put it all together and see whether or not you can really make a difference.
I see mainly geriatric patients in outpatient therapy, so I treat a lot of the cancer, rehab, and the lymphedema population. I think the best thing about being a physical therapist is that you are a motivator and a coach. It's not meant to be deep because the lymphatic system is directly underneath the skin.
I am a student physical therapist. Here, within a neuro setting, certainly you put your hands on, so you teach the patients what to do. But there comes a time where, I mean, it is just mental. So you put your hands on the patient, it's now time for them to do as much as they can.
I'm Tim Dockin, physical therapist with Fairfax County Public Schools. Take it off. Will has cerebral palsy. Good. Got it. Want to sit down? Yeah. Yeah. More than just being a physical therapist, I think, we're an advocate. And so we see so many aspects of these kids' lives and that we can help them out.
You're touching the side. Try not to touch the blue.
Our whole goal here in the middle school is to prepare them for high school. We make most everything into a game.
All right, there you go. Oh, nice one.
So the more fun we can make something, the more willing they are to do it.
Okay. Got it. Good job.
Andy had meningitis when he was a kid and had some brain damage because of that.
3, push up. Good. Stand up there. No, don't you sit down. Don't you sit down.
When I had decided to change careers and go back to school, I went and worked in an outpatient clinic, and I saw how they were getting people better.
Down. Reach with your hand.
The people I worked with were great, and the difference you made in these people's lives were great. This is Andrew, and he's 12 years old. He has cerebral palsy, so he has trouble controlling his movements.
And both together. Okay, Andrew, stop. Okay. Stop! Stop!
We want to get them to do as much as they can themselves.
Oh, that's perfect. Okay, we're doing donuts. That's not supposed to happen until you're 16. Ha ha!
It's just fun because you've made a difference.
Flexibility looks excellent. I'm Denise Constanti. I'm a physical therapist with the Jackson Clinics. You definitely need to have your hands on the patient and feel how their muscles are working and seeing if they're flexible. You have to have all three things coming together: flexibility, strength, coordination. I've actually come from this from the inside out. I was an amputee at a very young age. I had a prosthetic all my life. You learn to overcome, and I wanted to teach others how to do that for themselves too.
And what we call the ligaments, the things that keep the leg together. I'm a physical therapist assistant. All right, so now we're working your knees. If you want to be a physical therapist, you want to have a passion for the human body, because that's what you do. The human body is your business. Stabilize.
I used to have a problem with walking on the outside of my toes.
So what we wanted to do is teach Nikki to land more with her feet straight. And notice that when her foot is like this, she has got a normal arch. With every physical therapist who works with any athlete, you want to see your person win. And I want to see Nikki win, and I want to see her go out there and win medals. Hey.
My name is Virginia Howe. I'm a physical therapist. We're in the MATSI. It stands for the Military Advanced Training Center.
I just want to get up and walk or just run, and I can't. I've to learn how to do everything again, you know. My legs were taken away from me, you know. I need to learn how to live all over again.
When you are missing your knees, like Brian is, and you get mechanical knees or computerized knees, you have to relearn how to walk in a different way than you did before.
I'm the research physical therapist at Walter Reed, and I do a little bit of clinical work through my day, but as a research physical therapist, I'm also doing research through military grants. Andrew's actually just learning on the power knee.
I can see the potential it has, but right now it's just trying to get used to when it's going to move and how it's going to move. It's just real difficult.
So all of my day is spent doing amputee research and treating amputees. And then some of our research is early rehab, some of it's late rehab, some of it's to do once you go home. We try to hit all aspects of care. That red line that's coming up when he's walking over this gray area, for the joints that you do have left, your hips and you're on this side, your knee and your hip, you want to kind of minimize those forces, or at least make them as normal as the knee would expect. These guys are great to work with. They're unbelievable. It's orthopedics to the extreme, because you're doing sports med, orthopedic rehab, but with a patient population that wants to do that, and they don't have legs and they don't have arms, and you have to figure out how they're going to do it, how they're going to run and jump and ski.
I would like to be able to run my 2 miles in 13 and a half minutes.
This will be him in about 9 months to a year.
It's fun, it's creative, and they make it an extreme challenge every day.
You can be me.
You can be me.
You can be me.
And you can be me.